Neuroblastoma, most common intra-abdominal tumor in children. Most common extracranial solid tumor in children. Most common extracranial solid tumor in children. Second most common solid tumor in children. Most common intracranial brain tumor. Most common malignancy in infancy is neuroblastoma. Site of involvement, cells of origin is neuroblast cell, which are derived from neural crest cell. Organs involved, adrenal gland. Most common organ involved is adrenal gland, also known as suprarenal tumor. Second is paravertebral sympathetic chain or ganglia. Second most common involvement, paravertebral sympathetic chain or ganglia. Second most common. Third is posterior mediastinum. Neuroblastoma. And fourth is pelvis. Pathology, solid tumor, small round uniform blue cells. Small round uniform blue cells. Scanty cytoplasm plus hyperchromic nuclei. Scanty cytoplasm plus hyperchromic nuclei forms Homer-Wright rosettes. Rose petal rosette appearance with central eosinophilic material called neutrophil. Cytoplasmic processes. Note: differential diagnosis for small round uniform blue cells is non-Hodgkin's lymphoma, rhabdomyosarcoma, Ewing's tumor, and neuroblastoma. What is the differential diagnosis for small blue uniform blue cells? Non-Hodgkin's lymphoma, neuroblastoma, rhabdomyosarcoma, Ewing's tumor, and neuroblastoma. Clinical feature: abdominal mass, firm, fixed, irregular, midline. Abdominal mass is firm, fixed, irregular, and midline mass. Firm, fixed, irregular, midline mass. Constitutional symptoms: fever, weight loss, irritability. Horner syndrome: anhidrosis, meiosis, and ptosis. Horner syndrome: anhidrosis, meiosis, and ptosis. Heterochromia iridis, variation in color of the two irises. Features due to metastasis. The features due to metastasis are: to bone, most common site, you have bony pains. To retroorbital region with infiltration. To retroorbital region with infiltration, periorbital swelling and ecchymosis, raccoon eyes. To skin, blueberry muffin lesion, purplish bluish subcutaneous nodules. To skin, blueberry muffin lesions. Paraneoplastic manifestation: opsoclonus myoclonus ataxia, also known as dancing eye, dancing feet syndrome, associated with antineuronal antibodies. Paraneoplastic manifestation is called opsoclonus myoclonus ataxia. Ataxia, dancing eye, and dancing feet syndrome happens in neuroblastoma, is associated with antineuronal antibodies. VIP: vasoactive intestinal polypeptide hypersecretion, intractable watery diarrhea, and hypokalemia. VIP: vasoactive intestinal polypeptide hypersecretion, intractable watery diarrhea, and hypokalemia. Happens. VIP: vasoactive intestinal polypeptide hypersecretion. Hypersecretion. So because of VIP hypersecretion, what happens is watery diarrhea and hypokalemia. Investigation: urine markers. Initial investigations: metabolites of catecholamines, non-specific metabolites of catecholamines. VMA: vanillin mandelic acid. VMA: vanillyl mandelic acid. HVA: homovanillic acid. VMA: vanillyl mandelic acid, and HVA: homovalenic acid. These are the two metabolites which are detected in the urine of neuroblastoma tumors. Metabolites of catecholamines from the urine: VMA and HVA. VMA is vanillyl mandelic acid and HVA is homovalenic acid. One thing is MCQ is that you don't have to remember anything, you just have to recognize them from the options. So It's easier. NSE, neuron specific and enolase, most specific. NSE is neuron specific enolase, which is most specific. Imaging studies, diagnostic investigations. Imaging studies, diagnostic investigation. CT abdomen is the most common. You will see stippled calcifications. Tumor mass displacing kidney infralaterally, not seen in Wilms tumor. Tumor mass displacing kidney infralaterally, not seen in Wilms tumor. Radionuclide scan with iodine 123, MIBG, meta-iodobenzalguanidine, PET CT scan to rule out metastasis. Radionuclide scan with I-123 MIBG and PET CT scan meta-iodobenzalguanidine to rule out metastasis. It is to rule out metastasis. Staging, International Neuroblastoma Staging System. International Neuroblastoma Staging System. It is divided into 4 stages: 1, 2, 3, 4, and then 4S. Stage 1, completely resectable tumors of neuroblastoma. Stage 2, incompletely resectable tumors. In that you have 2A and 2B. 2A, no lymph node involvement. 2B, with lymph node involvement, only ipsilateral. Stage 3 crosses the midline or unilateral tumor plus contralateral lymph node involvement. In any tumor, stage 3 is important. So stage 3 of neuroblastoma, it is that tumor is unilateral. Tumor crosses the midline, or the tumor is unilateral but the lymph nodes of other side are involved. That is stage 3. Stage 4 is disseminated tumor. Stage 4 is disseminated tumors. What are stage 4? Spread tumors, disseminated. Stage 1 and 2 tumor with dissemination to bone, liver and skin in an infant, good prognosis. If it is stage 1 and 2 tumor with what is 4S? Stage 1 and 2 tumor but dissemination to bone, liver or skin, neuroblastoma. It has good prognosis. It has to be in an infant. 4S is in an infant, good prognosis. Risk stratification, low risk and high risk. Low risk stages 1 to 4S. Age of onset less than 18 months. Genetics, hyperdiploidy, TRKA gene expression, TRK gene, trunk age, TRKA gene expression. So stage 1, only one completely resectable tumor. Stage 2, completely resectable tumor plus ipsilateral lymph node involvement if present. 4S, dissemination to bone, liver or skin in an infant and it has good prognosis. And then age of onset less than 18 months. So the earlier it happens, it has more good prognosis in neuroblastoma. Genetics, hyperdiploidy and TRKA gene expression. It's all low risk. High risk, stage 3 and 4. Tumor crosses the midline. Unilateral tumor plus contralateral lymph node involved. Stage 4, disseminated tumors. Age of onset after 18 months. Genetics, hypodiploidy, NMYC gene amplification. NMYC gene amplification. Loss of heterozygosity. Loss of heterozygosity. 1P, 2Q. 1P, 2Q. Loss of heterozygosity. Genetics, hypodiploidy, NMYC gene amplification. Loss of heterozygosity. 1P, 2Q. That's high risk. Treatment, localized surgical resection of tumor. Treatment, localized, you have to surgically resect the tumor. Disseminated surgery plus chemotherapy with cisplatin, cyclophosphamide, vincristine, etoposide. Disseminated, you have to do surgery plus chemotherapy, both. So if it is a localized tumor, just resected surgically, that's it. Neuroblastoma, if it is disseminated, then you have to give chemotherapy. You give cisplatin, cyclophosphamide, vincristine, etoposide. Cisplatin, cyclophosphamide, vincristine, etoposide. No response, radiotherapy. If refractory, autologous hematopoietic stem cell transplant. If chemo is not working, if radiotherapy, if that's not working, then stem cell transplant, autologous hematopoietic stem cell transplant. Wilms tumor. Coming to the second solid tumor is your Wilms tumor. Features: usually unilateral, also known as nephroblastoma. Most common solid tumor of kidney in childhood. Second most common intra-abdominal tumor in children. Cell of origin is nephrogenic rest, undifferentiated mesenchyme of the kidney. Age 2 to 5 years of age. Usually unilateral, also known as nephroblastoma, most common solid tumor of the kidney in childhood. Second most common intra-abdominal tumor in children. Second most common intra-abdominal tumor in children. Cell of origin nephrogenic rest, undifferentiated mesenchyme of the kidney. Age 2 to 5 years of age. Association risk factors: malformation, horseshoe kidneys, 4 times risk of Wilms tumor, cryptorchidism, undescended testis, hypospadiasis. All these are complications, malformations associated with Wilms tumor: hypospadiasis, cryptorchidism, undescended testis, 4 times increased risk of Wilms tumor. And we are uh, talking about horseshoe kidney. Genetic syndromes of Wilms tumor: nephroblastoma. It is due to WT1 gene and due to WT2 gene. So WT1 gene, that is Wilms tumor type 1 gene, 2p13 mutation, 2p13 mutation, Weger syndrome. What is Weger syndrome? It is Wilms tumor and iridia, genitourinary anomalies and mental retardation. Wilms tumor and iridia, genitourinary anomalies and mental retardation, that is Weger syndrome, which is associated with Wilms tumor type 1, 2p to 13 mutation. Wilms tumor and iridia, genitourinary anomalies and mental retardation. Second is Denny-Dras syndrome, diffuse mesangial sclerosis, congenital nephrotic syndrome, association ambiguous genitalia in males. What happens in Denny-Dras syndrome? Diffuse mesangial proliferation in the kidneys, ambiguous genitalia. Congenital nephrotic syndrome. Nephrotic syndrome means gross proteinuria. Nephritic syndrome means hematuria. Due to Wilms tumor type 2 gene 11p15. Here it was 11p13, here it is 11p15. First 1 13, 2 15 mutation. And the syndrome is Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome. Large for gestational age baby with hemihypertrophy. Large for gestational age baby, a large baby, and that too with hemihypertrophy. You are suspecting Wilms tumor due to Wilms tumor type 2 gene, translocation 11p15 mutation. Microglossia, omphalocele, organomegaly, liver, spleen, earlobe creases. Everything is big. So large for gestational age, hemihypertrophy, macroglossia, omphalocele, organomegaly, liver, spleen, earlobe creases like a big man is all Wilms tumor type 2 gene 11p15, and the syndrome is Beckwith-Wiedemann syndrome. Beckwith-Wiedemann syndrome. Clinical features: asymptomatic abdominal mass in the loin due to enlargement of the kidney. There's an asymptomatic abdominal mass in the loin. There is an asymptomatic abdominal mass in the loin due to enlargement of the kidney. Increased renin, so there is hypertension in the children. Hematuria. There is hematuria. Side of metastasis, lung most common, then comes lymph node, and then comes liver. Most common site of metastasis is lung, then comes lymph node, and then comes liver. Staging: children oncology group staging, post-surgical staging. Children oncology group COG have given staging, which is post-surgical staging after surgery. Stage 1, 2, 3, 4 and 5. We'll see stage 5 bilateral kidney involvement, most severe stage 5 bilateral kidney involvement. Stage 1 limited or confined to kidney, completely resectable. Stage 1 is limited and confined to kidney, completely resectable. Stage 2 extends outside the kidney margins, completely resectable, lymph nodes not involved. So stage 2 is extends outside the kidney margin, completely resectable, lymph nodes are not involved. Stage 3 residual tumor after surgery, confined to the abdomen, regional lymph node metastasis, tumor extension into inferior vena cava. For any cancer you have to remember stage 3. So stage 3 of Wilms tumor says that after surgery there is a residual tumor which is confined to intra-abdominal. There is regional lymph node metastasis. So regional lymph nodes are involved, and there is superior inferior vena cava tumor extension. There is also extension into inferior vena cava. Stage 4 lymph node metastasis outside abdomen, hematogenous metastasis, mets to organs like lung and liver. Stage 4 is that lymph node metastasis outside abdomen, hematogenous metastasis, mets to organs like lungs and liver. That is stage 4. Stage 5 is bilateral kidney involvement. Treatment: nephrectomy, radical nephrectomy and partial nephrectomy. Partial nephrectomy is reserved for stage 5, surgery plus chemo plus radio. Surgery plus chemo plus radio, partial nephrectomy because bilateral kidney involvement. Radical nephrectomy stage 1 to 4. In that stage 1 and 2, chemotherapy, vincristine plus actinomycin D for 18 weeks. Stage 1 and 2, chemotherapy, vincristine plus actinomycin D for 18 weeks. What is in stage 1 and 2? Chemotherapy, vincristine plus actinomycin D for 18 weeks. Stage 1 is completely resectable tumor. Stage 2 is completely resectable tumor but outside the kidney margin. So you give chemotherapy, vincristine plus actinomycin D for 18 weeks. 18 weeks. 18 weeks is how many months? Close to 4.5 months. So 4 months chemo. Stage 3 and 4. 3 is important. 3 is after surgery there is a residual abdominal tumor, localized lymph nodes involvement, and extension into inferior vena cava. So that is stage 3. And stage 4 is mets into outside the abdomen lymph nodes and hematogenous mets to other organs like lungs and liver. That is stage 4. So chemotherapy, vincristine, actinomycin D and doxorubicin. So what is the chemotherapy? Vincristine, actinomycin D and doxorubicin for 24 weeks and radiotherapy. For 24 weeks and radiotherapy. So if you give it for 24 weeks and radiotherapy. So stage 1 and 2 chemo, stage 3 and 4 chemo plus radio, and stage 5 also surgery plus chemo plus radio, and partial nephrectomy. You cannot remove all the kidneys.